Hi, welcome back to my channel. So in this video we are going to talk about the lateral wall of nose. So this is like the most asked question. So first of all, you should get acquainted to the diagram. So let's just start. So first of all, you should know that there are three things. Okay, one is this. I'll just decrease the color. So see, one is this, second and third. So starting from up, so this is superior meatus, this is middle meatus, and this is inferior meatus. Okay, this much you should know. So see, this is superior meatus, right? And then the labeling of this is this is the middle meatus, right? This one, this, and then we have this, which is the inferior meatus. Okay, so this is getting acquainted to the diagram. Then over here you have something ki, see, you have middle meatus, okay, and then you have something like this. So this is what is hiatus semilunaris, okay, in the shape of a half moon, semilunaris, and this is what is bulla ethmoidalis. So see, inside part is bulla ethmoidalis and outside this part is the hiatus semilunaris. Okay, so I hope this much you know by now. Okay, then see the bones. So this is our sphenoidal air sinus, this is our frontal air sinus. See, this is the face, huh? Yeah, so this much I hope you know. So now let's just dig into the video. So you should know the openings. So first of all, we will talk about the openings starting from the see, now in this you should know the opening of anterior ethmoidal, then you should know the opening of middle ethmoidal sinus, okay, then you should know the opening of posterior ethmoidal sinus, then you should know the opening of maxillary sinus, then you should know the opening of frontal sinus. Okay, then you should know the opening of nasolacrimal duct, where it is opening. But these are the only questions that you will be asked. So let's start from anterior ethmoidal sinus. Now you have to remember that anterior ethmoidal sinus is basically present in the, see, first we'll start from the hiatus semilunaris. So yeah, so anterior, so to remember this you have to know a password which is FAM. Okay, so you have the see, this is our hiatus semilunaris, if you know properly. Like, see, this is the middle meatus. I'll just draw it in a better way so that you are able to know it nicely. So see, so this is this. So here now you have three openings in the hiatus semilunaris. So just go by the password only. So FAM. So this is the frontal sinus, then we have anterior ethmoidal sinus, and then we have the maxillary sinus. Okay, so see, the first one, the most anterior part will be the frontal sinus. Okay, so this will be frontal sinus, then middle may you will have anterior ethmoidal sinus, and then posteriorly you will have the maxillary sinus. You have to remember it in this way only. Sometimes they ask anterior mein hiatus semilunaris ke what is present, posterior mein what is present, and middle mein what is present. So you have to know this by heart. Then in bulla ethmoidalis, okay, now in bulla ethmoidalis, we'll come to it later on. So now we are done with anterior. So in the now let's talk about the anterior middle ethmoidal sinus. So middle ethmoidal sinus, you have to know that the middle ethmoidal sinus will be present in the bulla ethmoidalis. Okay, yeah. Then the superior meatus. See, we are done with middle. Now we'll talk about posterior. So posterior ethmoidal sinus will be in the superior meatus. Okay, then let's talk about the, so this is like we are done with superior meatus, we are done with middle meatus. Now let's talk about inferior meatus. In inferior meatus, this one, so this is the opening for, see, we are done with this also. So nasolacrimal, so nasolacrimal duct. Then sphenoethmoidal sinus has the opening for the sphenoidal air sinus. Okay, just by the name only, sphenoidal. It's written also air sinus. All right, now let's just go through them once again. So starting from the hiatus amylonaris, so I told you fam, so maxillary sinus, anterior ethmoidal, and frontal. See, frontal is the anterior one, then this is the middle one, and the maxillary sinus is the posterior one. Then bulla ethmoidalis has middle ethmoidal sinus. Then superior will have posterior ethmoidal sinus. Then inferior meatus will have the opening for nasolacrimal duct, and the opening in the sphenoethmoidal will be sphenoidal air sinus. Okay, so done. Now we also need to know the blood supply also. So there is a very simple trick that you should know and remember for the blood supply of nose. So blood supply of nasal septum or nose, whatever. So see, we will divide it into 4 parts. So this will be my anterior part, which is superior. This will be my anterior part, which is inferior, right? And this will be my posterior superior, and this will be my posterior inferior quadrant, right? So now let's just go through this only. So anterior superior may we have anterior ethmoidal and posterior ethmoidal artery. Then anterior inferior we have lips, right? So superior labial artery and the labial branch of facial artery. Okay, then posterior superiorly, see first we have posterior inferiorly, which is greater palatine artery, and then we will talk about posterior superior, which is our sphenopalatine artery. Now in this sphenopalatine artery also, if you watch my maxillary artery video, so you should know that this is from the 3rd part of maxillary artery, and it is called as the artery of epistaxis. All right, so yeah, so this was about lateral wall of nose. So yeah, if you like the video, yeah, but one more thing, let's just talk about the blood supply of Little's area. Blood supply of Little area, or the Kaisel back plexus. Okay, now this you need to remember no matter what happens. So you can remember it by gas. So G stands for greater palatine artery, A stands for anterior ethmoidal artery, S stands for the superior labial artery, जिसकी septal branch है. Okay, then S stands for the beloved sphenopalatine artery, septal branch. Okay, so yeah, so this is about the lateral wall of nose, and yeah, and nerve supply also is important. Yeah, this is the question that I usually get wrong. So nerve supply of nose, if you know, you can comment it down and I will tell you if it's right. So yeah, if you like the video, do subscribe to my channel, give this video a like, comment, and thanks for watching.